Yes, we wanted to ask you an update, on what Ogun State government is doing, especially concerning getting centers ready for further or possible cases of coronavirus.
Thank you very much. Part of the effort we're making is to increase isolation centers from the original one at the Olabisi Onabanjo University Teaching Hospital in Shagamu to 3 other locations that can take as many people as possible. One will be in the NYC orientation camp. Another one will be somewhere in Inname. And we're also looking at Abeokuta, where facilities have been upgraded and improved upon and are almost been made ready for use. This is because we believe that the contiguity of Ogun to Lagos is such that leaves us with no chance to leave anything to chance. We have done quite a lot to reach out to any known contact of any incidence case, isolate them, and those who have gone down with symptoms have been tested in the circumstance. Few have recorded positive results, and a good number have returned negative. And some, in the course of the incubation, did not even come down with any symptoms at all.
Really, in Sokoto, we are on top gear, trying to make sure that we have taken measures to prevent and contain the outbreak in the state. One of it is all schools are closed. All public schools, and including other private schools, tertiary, secondary, and primary schools, they are all closed. We are also mounting screening checks at the borders. We have 4 borders, 4 land-borne borders that we are mounting screening checks in collaboration with the Nigerian Immigration Service and the Port Health Services. We have also designated a isolation center in the state and a holding center at the specialist hospital and isolation center at the infectious disease hospital.
Let me ask you, sir, what's the capacity of your isolation center and how many test kits do you have?
The capacity of the isolation center for now is about 20 bed capacity, the isolation center, and the holding center, which is a holding center before you move the patient to the isolation center, is 10 bed capacity.
In an occurrence of a possibility of a case in your state, would you have to move that person to Abuja, or do you have enough equipment within those holding places to actually take out the tests and treat the possible case?
No, what we do is the closest reference lab we have is in Abuja,
okay,
where we usually take samples and transport those samples within a maximum of 12 hours to Abuja and get our result. And that's what we have been doing because the protocol says that the NCDC is encouraging people to have centralized testing centers instead of scattered or everybody have a testing center individually.
I'd like to know what you're doing to enforce social distancing within the correctional facility.
Before the first index case was recorded in Nigeria, the Control General have already summoned a high-powered meeting and also inaugurated various kinds of committees to synergize with the state government and the federal Ministry of Health in any possible outbreak in any of our centers. So after, we observe all other procedures, hand washing, sanitization program, campaign in all facilities, space created in major centers, custodial centers, and isolation wards in all of our custodian centers. Then public health officers are also directed to fumigate as much as possible to all cells and surroundings of the facilities.
I understand that you are no longer taking new inmates, but what are you doing to decongest the already overpopulated cells?
There is no way because the court is not working, the prerogative of mercy is not working. We are partial shutdown in most government processes. There's no way anybody can come now and say we release any inmates because of outbreak of COVID-19. What we are doing is to put things in place, to put procedures in place to contain any possible outbreak in any of our centers.